you so much. Actually, okay, go ahead. Tell us.
Thank you. So I'll give you what my university did, what we did to help address this problem, which is not knowing what to apply to or not finding enough positions. So the first solution, one of our classes had, it was in a hospital. It was in Pomona Hospital in Pomona. And the director of health services there, it was a 10-week course, and every week during the class, he brought one of the heads of the departments, environmental services, HR, risk management. Each week he brought one representative or department head, and he used to talk about, that person used to talk about what is the position, what do they are looking into hiring, what are the certificates that are needed, what experience that are needed, how to reach out to these positions, and just line up the steps on how to reach each position. It's either environmental services, HR, or strategic management and planning. That was one part, and I think that was very, very helpful. So for me, I was in medicine, and then I moved to healthcare administration. That was great for me to see each department, how is it working, and see where I want. Like, I don't know, when I went to the MHA, we did our classes, but I didn't know which department I would like, or which day-to-day job I would like. And that was really like an eye-opener. So is the American Care executives, very helpful. The CE, the California Southern Department, the California chapter for it. They do early careerist meetings. I was a student member on it, and it was very nice. We reach out to each university, and each university has a representative that brings students to join the membership, and we highlight fellowship opportunities, because there is fellowships for healthcare administration. It goes through a portal called NAFCAS, and that portal, you need to prep for it. So we used to get fellow panelists, and we used to have like meetings regularly before COVID, and after COVID and during COVID, they do it now on Zoom. I don't attend as much because I'm a little bit busy now with my work. So, but it is very, very valuable. I met a lot of people in different organizations, CHOC, CHLA, multiple places, and they're very helpful and very nice people. So that is a must for all MHA students. Like, it's a must. If you want a healthcare organization or healthcare administration or executive, you need to be a member of that one. And it also, after you reach a certain level of experience with them, you can get the FASHI, the fellow of the American College of Healthcare Executives, which shows that you're really committed to this mission. So these are I think the first two parts. The second or third part, I think, is being in the community. Like, try to see a community organization. I'm a Randall Lewis fellow. Randall Lewis is a developer in the Inland Empire, and they had partners with a lot of private and public organizations. And when I joined the fellowship, they get your resume and everything, and then they match what you want to do, or what is your strength, and which organization would fit you best. For me, I was in San Antonio Regional Hospital. I was a part of my fellowship was to create and lead the COVID-19 initiative, or vaccine awareness initiative. So it was very good for me. I was able to reach a lot of organizations all over the Inland Empire at San Bernardino, Riverside County, at San Bernardino County. We were able to meet our metrics, and everyone was happy. It was targeting specifically the Spanish-speaking community, because there was a lot of misinformation and people were very scared from the vaccines. So that was one part, and that grew my connection, my network, by reaching out to them and doing my one-on-one with each of these organizations. That increased my visibility in the Inland Empire. Through my work, the program, that I got two offers actually. One from my director in San Antonio Hospital. Had a friend in a company, so this way he was able to like reach out to him. and show him like my resume and my work. And then they were very interested, but unfortunately, because I was international, things did not work out for visa. And then, yeah. So that was one of the parts that did not work, but it was a very good opportunity that I would not have been able to get if I was not in that position. And then before the completion of my fellowship and submitting the final poster and everything, my fellowship director, she knew my interests from our interviews and extensive one-on-ones. She was able
Sorry, that's like a sensor.
No worries. She was able to match my areas of interest, which is technology and healthcare, and increased specialty care for the general population with Wise Healthcare. Wise Healthcare, the company I'm in, does a virtual care as a service. So it works with the Inland Empire Health Plan and multiple other clients to provide clinical support to primary care physicians in the community for the underserved and rural PCPs, the primary care physicians, with a specialist network. So there are specialists who review the cases that need referrals, and then they provide the best next step for that patient, which reduces the driving costs or the risk and the wait times for the patients in those remote areas, the deserts, and Arrowhead. These all very limited access to specialty care. So that is what the company does. For me, my day-to-day in Wise is I'm project manager. So there is multiple projects I'm working on. The company is a startup. It has been a 3-year startup, but it is still a startup. So I wear multiple hats. I work, yeah, of course. Since I'm a physician, I work a lot on the research side because the company does some research to see the outcomes of a lot of the consultations. So I work with a team of clinicians, med students, interns, and the primary care physicians to do metrics and see
So we're managing the team of physicians, or are you actually doing clinical work as well?
No, I don't do clinical work. So we do like a weekly meeting with the team of physicians who provide their input, and the med students do some research or data analysis, and the interns do a lot of the outreach stuff as well, like reaching out to the PCPs, the phone calls and stuff like that. I am in the middle of all of it with tracking, keeping everything on the same, so no work is duplicated. So that is like my role there. Finding out other opportunities for research during the process when I'm seeing what is going on in the company. The other one is physician engagement. Those specialist reviewers who review the primary care consultations. I reach out to them, make sure that everything is in order, that they're able to use the platform correctly, that they're happy, because all of these physicians their compensation is very minimal. So they are doing it for the benefit of increasing access. So we have to make sure that they're happy. So that's one of my other hats. The other one is they're onboarding new clinics, like primary care clinics. So I usually join if there is anything that I can answer from the primary care perspective, because some of the primary care physicians feel it's going to be a lot of work, but they are not getting reimbursed for that work, but it is increasing the benefit of their patients. So I joined that meetings or those trainings to answer each question as they arise for the skeptical primary care physicians. Well, that's, I think, pretty much it. There is a technical part in the company that they are developing software. So I usually join on giving my input or testing to see if there is an issue in the software from a clinical side, which one works, which one does not work, for like as a broader image before they launch that software they're doing. No worries. So that's pretty much it. My day-to-day is I just join meetings, check at metrics, pull reports. No worries. Pull reports, find areas of expansion or improvement. That's pretty much it. So it's very nice. It's good paced, with a lot of potential of growth.
What are like any kind of challenges that you seem to go through on a day-to-day?
Well, the challenges in my day-to-day is usually reaching out to people, because everyone has a different schedule, and specifically physicians are very hard to reach out to. So that's why we have
Right.
interns, and we have everybody on the team keeps trying. If we want to reach a specific physician, everyone keeps trying the phone call, especially primary care physician clinics. They usually don't answer the phone at all. So that takes a lot of time in the process. But as a challenge for me to do my work, I think it's very limited, because I have almost a decade of experience in healthcare system. So my parents are physicians. My dad is a hospital manager. So I've been exposed to all of the problems that arise and could arise. The other part of the challenge for the company as a whole is the policy. Like, the policy needs to be changed, so primary care physicians get reimbursed for this service that they're doing, which will increase the access and will make people more likely to join this mission.
Okay, that's good.
Mhm. Yeah.
Well, what can you say that might be attractive for this type of a job? For
From which
undergrad?
perspective? For
Well, as a
undergrad?
student, what do you think might be a perk? Just being a project manager, having all these hats, everything that you have to do with. Are you really into maybe like a fast pace type of an environment?
Yes. So it is not fast paced as you would imagine.
Okay.
It's pretty consistent, and I think the perk is that you really improve access to patients. Like, the company did 100,000 e-consults, so there's 100,000 patients. You're not looking at it as just a number. Those are real patients who did not have to drive, or when they drove, they had a better quality access to care. So that is one part, and that is, I think, the main part for me is the fulfillment, that my work will impact a lot of people, not just it's just paperwork, or that's just a job that you're doing. That is actual human beings behind each of those consultations. Those are real people, and this is for me, this is the main part, this is the perk. You're actually improving access to care in the Inland Empire. So that is one part. The second part, I think it's being a project manager will allow you to see a lot of issues, a lot of experience, which will make you can be in that position for like 6 months to a year, and they're going to be able to move to a different organization or move up in that position in the same organization. If you find a specific project that you're working on, you can move specifically in that one into like a director role or a more higher role than a project manager.
Oh, so is that kind of what you plan for yourself? Maybe you want to this will help you specialize in it.
Exactly, yes. So I'll be able to see which it's different completely from being in the classroom, for seeing from the outside, then in the middle of everything. And then I'll be able to find where I really feel my impact is the most needed, and which is most challenging for me, that it makes me want to go every day to my work and be, okay, where's the next challenge? So that is my part.
Is that kind of what attracted you to this type of position?
Yes. Also, that the company is a startup and it does medicine and tech, and I'm a really big fan of medicine and tech. So because I really think that a lot of the visits for physicians could be done remotely, and it will save a lot of people a lot of time, a lot of anxiety, a lot of waiting in the doctor's lounge. All of this could be avoided with just some technology, or sitting in the house, you open your Zoom and you're able to meet the doctor. A lot of the visits for follow-up or like dermatology, those ones are like, it's a spot diagnosis or just a follow-up. So
Like I work with telemedicine and
Yep.
whatnot.
Yeah.
That's good. So what actually interested you in going for an MHA degree?
So I was a practicing physician in Egypt, trained in Egypt, France, and I did training in Cedars as well. When I was doing my training in Cedars, I saw that healthcare is here in the US specifically is mainly managed by insurance and administration more than the clinical side. So I felt that, and I was able to see that there is a lot of people who are passing away just because they cannot afford their medical bills, and that really is very bad. It shouldn't happen in this time and age. Like, it shouldn't happen. So that made me go for an orientation in the University of Laverne to see what is MHA, what are they talking about. Because I felt like a lot of the physicians here, you just have the clinical and then a lot of legal issues, a lot of administrative issues makes them unable to practice medicine as they would have liked, all that managed care and everything. So that interested me, that being in a healthcare administration, I'd be able to affect more people than just the bedside one-on-one with the patient. I would be able to increase or set policy that would help, or like be able to influence policy, or be in a position that I could be influencing policy.
That makes so much sense. Um, so I know you've already kind of like discussed about a lot of variety of resources that especially graduate students should take advantage of if they're trying to get into to go down this type of a career path. I don't know if you know of any resources that might be of help for undergraduate students, or do you believe that they would, because I don't know if they would necessarily have the same access to everything that a graduate, like a master's student, would really have, especially joining a fellowship.
Yeah.
I don't know if you have any advice or.
I'm not sure there is a fellowship for undergrads, but there is a lot of internships. So I feel that there need to be an outreach from your university to the local organizations. Most of them have reached to a lot of the organizations in the Inland Empire, and most of them are more than willing to help in any way they can. So I think this could be a path for the university to explore, is reach out to the local organizations and try to establish connections with them. Not just tell the students, oh, go look for a fellowship. In the University of Laverne, they have an office where the office for undergrads and grad students, they do outreach to organizations and get internships for people, and then they email it to everyone in the program. So that one is very nice. Wise Healthcare does internships. So
I'm
if
actually gonna ask.
yeah, no worries. So if you have, I'll share with you my email and Chief Operating Officer's email. He is an adjunct professor, I think, in Loma Linda, or he gives classes in Loma Linda. So he's pretty nice, and we always welcome interns on a regular basis.
Okay, yeah, that would actually be really great. So
Yep,
if anyone wants to contact you, would it be okay to just
share my email. Yep,
share your email,
yep,
whatnot? That would be great. Anyways, thank you so much for joining me.
my
I don't
pleasure.
know if you have any questions or anything about me or anything that we do, but
It's all good. I think just the one thing that healthcare is a big industry, and the undergrads who are unable to find jobs that easy, they should just the main word is persistence. Just have persistence, and there is a lot of jobs. I know currently the work climate is not that great because of the pandemic, but it is improving. There's a lot of positions opening up, and a lot of companies are hiring. So whatever is happening now on how hard it is now, it should not be as hard as moving forward. So
okay,
fingers crossed, everybody, and
that's
don't
great.
worry. Yes, exactly.
Thanks. Okay, thank
Um,
you so much for joining.
my pleasure.
And yeah, we'll share your email with students, and good luck with everything.
Thank you so much. Thank you.
Bye.
Bye bye.